Good to go? Yes. Well, good morning, Queensland, and wonderful news. We have 0 new cases today, so it is a double donut day. We have 12 active cases, and I'm really pleased to see the number of people still coming out and getting tested. So we had 9,545 tests in the last 24 hours and 10,533 vaccinations. That now puts us at 78.21% first doses and 64.71%. So we're getting very close to 80% for those first doses, which is fantastic news. But of course, the message is clear: keep coming out and getting vaccinated. And that's why we are standing here today, because we have partnered with Clubs Queensland, and I want to acknowledge Kelly Egan, the Chief Executive Officer for Clubs Queensland, who said the community clubs across Queensland wanted to do their bit in supporting the vaccination rollout by offering families $10 vouchers for anyone who's getting their first dose at certain participating clubs. Now that's 7,250 meal vouchers. So you think about it this way: if you're a family of 4, all eligible to go get that first jab, you could go to one of these eligible vaccination hubs and clubs and get $40 off your meal just by getting vaccinated. So that's a wonderful incentive, and I want to thank Clubs Queensland. I'm standing here at the North Lakes Community Club here with Chris Whiting, local member, and I know this is a great club and we love our community clubs across Queensland. They do such a great job supporting their communities, investing back into our communities, and of course they're very important employers as well, and providing employment and training opportunities across Queensland. So I want to thank them so much for partnering with us, because this is just another incentive for people to come out and get vaccinated. I also want to report that the Kabucha review, the report will be handed down around midday today by the board chair of Metro North Hospital and Health Service. I can report in relation to that report, there was 19 recommendations. I'll leave it to the board chair to go through the detail, but I do believe it's important to indicate from the findings of that review that there has been no findings in relation to any individual doctor, and in fact no findings that any doctors were working outside of their scope of practice. But the main themes of the recommendations that you will see when the report gets released today is around governance and culture and reporting, and most importantly how the HHS and particularly Kabucha Hospital can improve the way that they respond to complaints from patients. And I do believe that there will be learnings from this review that can be considered by all of the hospital and health services to ensure that they're doing the best they can to give the quality care and responding when patients do come forward with any concerns or complaints. I'll now hand over to Dr. Aitken just to again talk about not the new cases, but just again talking about the importance of vaccination, and of course please keep coming out using your QR code, wearing your masks where you are required, and getting tested. Thank you. Dr. Aitken.
Thank you, and it is lovely to be able to stand here again and say 0 new cases in the community and 0 new cases from international arrivals. Again, that's really important. 78.21% vaccination, as the Minister said, very, very close to 80%, and once we reach 80%, we know we can get 80% for double dose as well, and that really helps protect the community. In the meantime, if you have symptoms, please come forth and get tested. If you haven't been vaccinated, please think about it, and think about it not just for yourself, but for the rest of the community as well. Also, just like to thank Clubs Queensland for their involvement in the vaccination effort. It's a really important initiative to bring vaccination into the community and make it accessible to all members of the community. So just one more way for everyone to, again, just please get vaccinated. Thank you.
Thank you, everyone. Welcome back once again to North Lakes, to the North Lakes Sports Club. Thank you to the Kabucha Sports Club Group. Thank you to North Lake Sports Club, and thank you to Clubs Queensland as well. This is a really great initiative to prompt people to get vaccinated. This sports club group, Kabucha Sports Club Group, donates $2 million each year back to the community. They know how to look after our local sporting groups, how to look after our local community. And we would really love people to follow that example, make sure that you're looking after your community and get vaccinated. This is a great initiative, a voucher for when you get vaccinated to spend within your community, and that money does come back. So thank you once again to the Kabucha Sports Club Group. Thanks to Clubs Queensland, and please everyone take the step to get that vaccination.
So I might just, these vouchers will become available from tomorrow, so from Thursday. We will put up on the website today the participating clubs and which vaccination centres will have the vouchers. So you will receive the voucher on exiting those vaccination hubs after getting your first dose. So please make sure you're having a look. I don't want anyone turning up to a particular hub that isn't participating in this and not getting a voucher. So have a look at which clubs and which vaccination hubs to pick up those vouchers from, because that will be really important. But it starts from tomorrow and they'll be eligible through to Christmas. Yep.
Minister, speaking with the lady that runs the Boulevard Showgrounds again this morning, she wanted to put some questions to you which she can't do. She's asked me to ask you why she's had more people showing up again today, why these people that are Queenslanders can't get home, and when they will be allowed to get home, and how come they're not part of this trial when we're about a month and a half to 2 months out from letting everybody come in.
So remember what the trial is. The trial is allowing people to arrive by air and home quarantine. Now, we are already over 70% first doses. We are very close to 70% double dose. When we hit 70% double dose, every single person wanting to come in who's got an eligible premises, who can fly in around the state, will be able to home quarantine. So this is going to significantly change in the next... I appreciate they're in their cars, but we cannot open up to people driving all the way through the state. They're Queenslanders who have taken their vehicles interstate. The rules have been very clear since we went into hotspots, and this has been the rules since the start of the year. Every time we've had hotspot declarations, we have said the only way you can return back into the state is by air, because by road they will have to stop. And we don't want to start carving up the state at the moment and saying, well, if you're within 1 hour's drive, you can drive in. But if you have to actually stop for petrol and you stop for food, you may even have to stop overnight to get back to your residence. It is not safe until we get to that 80% double dose. Of course I don't. And they can apply for exemptions. And there have been exemptions granted in certain cases because of people's living arrangements. The exemption team will work through this. But since we released the time frames for opening up and allowing people to home quarantine, we have seen a massive influx again of people applying to come across the border. Thousands and thousands of people are now wanting to relocate to Queensland, and Queenslanders wanting to come back who hadn't necessarily made applications earlier. So there's thousands more for us to process. Exemptions are still being considered by the exemption team, but we are so close. We are so close to being able to let people home quarantine and allow people to come by road. And for all those people who have loved ones who are stuck interstate in hotspot declarations, the one thing they can be doing is getting the message out. Queenslanders, you can fix this straight away by coming out and getting vaccinated. The more people who come out and get vaccinated now, the quicker we can reach these benchmarks. The exemptions unit's still operating. Look, our numbers fluctuate in relation to these teams all the time. We've got people coming in from different agencies from time to time. You've got to remember, these people are not just merely administrative tasks as well. They are clinicians, they are psychologists. We have mental health experts working in these units, working through all of these exemptions. Look, I'll have to go back and see what the numbers are today and the staffing that's there. But we've got to be clear. Our mission is to try to open up as quickly as possible so that people can come back by road or by air. And we get to that 80% double dose, we will be able to do that. That's how every Queenslander can help with getting people back to Queensland as quickly as possible, is getting us to that 80% double dose rate. In full, yes. Well, as I say, I'm pleased that there's no findings of inappropriate behaviour or conduct by doctors in relation to their practice. But it is concerning around the governance issues and the cultural issues. I do think there'll be lots of learnings to come out of this. And it's good to shine a light on any practices that require improvement, and that's what this report will do. I'm not going to go through it in detail because the report hasn't been released, and the board chair will stand up today and go through that report in detail. So, pardon? No, the board chair will be standing up, but I'm happy to answer any questions upon the report being released and everyone seeing what that all the findings are, and also the implementation plan that I understand the board chair will be releasing today. Now, I will say, well, I'll be travelling shortly to go back to trying to get our vaccination rates up, but I'll be available to answer any questions whatsoever. But I do have other commitments today, and we just weren't able to line it up between the board chair and I this morning, and that's why he'll be standing up today and speaking to it. But be clear, I am more than happy to answer any questions. It's not appropriate to talk now about the report when it hasn't been released yet, and it's appropriate that the board chair gets to speak to that. So.
Will extra restrictions like masks be considered for regional Queensland when borders open back up in areas that have low vaccination rates?
Well, restrictions will only be put in place where there is outbreaks occurring. They won't be put in place as a preventative measure. They'll be put in place where there's outbreaks. But we have been saying this for some weeks now, that the virus will move through our community. As people start arriving by air and by road, we can expect that some of these people will carry the virus, even though they would have been tested negative before they travel, and we will have outbreaks happening across Queensland. That's why we need people to be vaccinated as quickly as possible. That's why I'm travelling again this week. I'm travelling again to the far north next week, because what some of our trips have shown, I got figures this morning that Moranbah, for example, that I visited recently, had over a 4% increase in 7 days. Now that is fantastic, a 4% increase in 7 days to the vaccination rates. I want to see so much more of this because this is how we're going to keep everyone safe.
On international arrivals,
Sorry.
we spoke about how they still have to quarantine up until 90%. And the other reason you gave the other day in terms of health concerns were the efficiency of vaccines from overseas and also possible new variants. Doctors though say any new variants that are around, they'll already be in New South Wales and Victoria from as soon as today because travellers are already going there. And also they say in terms of the vaccines, the Commonwealth says that you need a TGA approved vaccine to actually get into the country. So is there any actual scientific, any other reason why
we have acted on the health advice the whole way through. We'll continue to do that. We know far more people are coming in with the virus than what we've seen domestically coming across our borders because of the measures that we have put in place. We have set a target of 90% because we believe that until that time the risk is too great, and we want to make sure that we've got as many people vaccinated as we possibly can. And we will still have to hotel quarantine people. What other states are choosing to do and letting people come in, that is their prerogative. But while we have this rule, if they have travelled overseas in the last 14 days and seek to come to Queensland before that 14 days up, they will have to quarantine in some way.
Two reasons which we discussed. Is there any other scientific or medical reason to discriminate against double-vaxxed international travellers and double-vaxxed interstate travellers? Is there any reason apart from those which we've just discussed?
Look, well, I'm happy to let Dr. Aitken talk to this because it's the health advice that we have followed. all the way through, and the advice we've got is to still have restrictions in place for overseas arrivals until we hit that 90% to keep us safe. So I might just ask Dr. comment further. Thank you.
Sorry, the mask always gets stuck. Look, you're right, those are the two main reasons, but it's also managing the risk, and that's really what it's about. If those people come into New South Wales or Victoria, they should be staying there before they travel through to Queensland as international arrivals. Rather than coming directly into Queensland, that means they do have that period of time in New South Wales. It also means that we have less people of that higher risk group coming into Queensland and less likelihood that we will get those cases appearing in Queensland, which means less risk to our community and less impact to our hospital system.
There are going to be people who are coming from countries where there's less COVID than there is in Victoria and New South Wales, so why the discrepancy?
Look, at this stage, those who can arrive into Australia is a decision for the Commonwealth, not for Queensland.
The Commonwealth, it's the Queensland government's decision to quarantine them.
It's
and if they're double vaxxed,
so
what's the difference between them and some from interstate? What's the rules?
the Commonwealth decides which countries are high risk and low risk. We can only look at the quarantine arrangements for those who arrive. So our point of view at this stage is that unless those countries are deemed green countries and safe travel zones by the Commonwealth, we will quarantine all international arrivals as a safety blanket for Queensland. I might just take one question at a time, sorry. Again, it's all about safety. As the Minister said, currently Queenslanders coming back in who have left can come back in by air under the current home quarantine trial, and from 70% they'll be able to come back in by air to a broader range of areas in Queensland under the conditions that are being determined and reviewed at the moment. We are very keen. No, at this stage there are still people who are getting home quarantines through exemption circumstances, and as the Minister said, all those cases are considered and what's the best option for those people and safety. But at the moment it really is about vaccination and getting the community levels of vaccination up to make sure the whole community is safe. And this is really hard because it's about the best thing for an individual but also the best thing for the rest of the community.
What if they're double vaccinated? Are they given priority?
And passed a COVID test.
Even being double vaccinated and had a COVID test, vaccination reduces the likelihood that you will get really sick. It also reduces the likelihood that you will spread disease, but it still is a risk there. And at this stage, that also means a risk to the rest of the population in Queensland.
Dr. Jeanette Yarn, for the past month, has said Queensland has to live with COVID, we're getting COVID.
Yeah.
We just prolong it. Why can't these returning Queenslanders, as Tim raised, people that are coming back from overseas and countries that have left less COVID than the states they're landing in, why can't Queenslanders come back in? Because we're going to get to the point, like Qantas has already said, that people will bypass Queensland. And it's killing tourism.
New South Wales, sorry,
Sorry,
if
I
you want
might
to jump
just
in.
add to that. The difference between Queensland, New South Wales and Victoria right now is they've got far higher vaccination rates. There's one thing Queenslanders can do to ensure we can open up our borders quicker, and that is to get vaccinated. The risk is still too great. We've got 30% of our population are not double dosed, even at the 70% rate. So we need to get the vaccination rates higher. That's the difference. We talk about, well, why should the other states be allowed to have people come straight in and Queensland be different? Because Queensland's got lower vaccination rates, and there is one thing we can all do to change that, and that is go out and get vaccinated as quickly as possible. Well, the reality is that those states that haven't had major outbreaks have had lower take-up of vaccinations. First of all, we didn't have sufficient vaccine, so you couldn't open it up to everyone. We had to wait for the supply to come, and the evidence is very clear that we weren't getting the supply early on. But the reality, once the supply's here, the fact is we just haven't had the major outbreaks. Victoria and New South Wales have had such high vaccination rates because people came out and got vaccinated when they started getting big outbreaks, when people started dying, when their friends and family were ending up in hospital. Over 70,000 positive cases in New South Wales alone since June. Remember, when the cluster broke out on the 16th of June in New South Wales, they had 4% vaccination rate, 4%. So they weren't miles ahead. We were actually ahead of them on the vaccination scale until they got the major outbreak. And that's my concern, is that people are sitting back and waiting, thinking, this isn't a problem for me. We don't have the virus in our community. We don't have to get this right now. Well, you do have to get this right now, because it is the only way to protect you before the virus comes. Because we've seen what happens if you wait until afterwards. It will spread.
About Central Queensland, given that the health service there suddenly cut medical beds as a result of having 385 workers not meeting their mandate, how concerned are you about the cutbacks like that?
Look, these are always going to be difficult decisions. We've been supported by the unions and all the stakeholders in doing this because all of them know, and all the modelling says, and this is why the TGA's own, the AHPPC's own advice is this needs to be done, is because the number of staff we would lose if we had a major outbreak and they were unvaccinated would be far greater. So we would be shutting down lots of wards, lots of surgery, because staff would be at home sick or worse still, in hospital beds themselves. So we know that this is going to put pressure on the system in the short term. I'm confident, though, we will see these numbers come down fairly quickly. The show cause is for 2 weeks. We saw this with aged care, that the aged care numbers were lower when we hit that mandated date, and now we're at 100% first dose. So I'm confident that we will see an improvement in the next week or two with those who haven't been vaccinated yet coming forward and getting vaccinated. Look, I don't make those decisions. Those are decisions that are made at hospital level as far as managing leave. But I'll say this, our staff have been working tirelessly for almost 2 years straight. Most of these staff didn't get to take leave last year. So staff need to take leave and we need to manage that leave because we need to look after our own staff. And I would be concerned if we were cancelling everyone's leave because we know what's going to come. And it's going to come and it's going to build early next year with the number of cases that people will have the virus and need to be hospitalised. So we're going to need our staff fresh and able to work, and that's why they need to be vaccinated. And I'm sure the hospitals will manage that. And we are looking at getting contract staff in and casual staff now to supplement any shortfalls. So it's gone back to the recruitment panel. I haven't been given a set date at this stage. It'll be up to the panel to look at the applicants that they already had and whether they will be making a recommendation on those applicants or wanting to go out further for another recruitment. Oh, look, I'd like to see a permanent Chief Health Officer as quickly as possible, but having said that, our Chief Health Officer currently appointed, being Dr. Peter Atkin, I know is going to do a great job.
And on Kabucha, on Kabucha Hospital Review, with the learnings in terms of culture, is that to do with perhaps the delays in handling patient complaints?
Yeah, look, what appears from this report is there certainly is examples where complaints weren't followed up properly, and we need to improve the way we engage with patients and their complaints. And as I say, I'm hoping that all of the HHSs will look at this report, then go back and look at their own systems and make sure that they are meeting the expectations of the community.
We had the case where the guy, Jody, who waited in emergency for 7 hours. He went to a doctor who said, get yourself to hospital, you've got stomach pain. He said he walked into the emergency, waited for 7 hours, and believes that's when his appendix bursted. Now, the Metro North tells us that emergency was at 180% at that time. So is there a case where the whole system is to blame for his care?
Oh, it's not the whole system to blame. What we have to remember is that we get surges in our emergency departments any time of the day, and as best as you plan for all of these things, and many of the measures that we've been putting in place have opened up bed capacity, but as quickly as we are opening up bed capacity, those beds are being filled. That is why we do need support and I will be talking with the Disability Minister federally this week, as will other health ministers, because we have cleared around 80 beds already, people with disability, and they've already been filled again. But it all relates.
The finger of blame in his case can't be pointed at anyone, but should he have got better care?
Oh, look, I'm not going to comment on individual cases. I don't have all the facts around his particular situation and the decisions that were made in that ED at that time. It's not appropriate to be commenting on individual cases. But of course, we want to see people transitioning from our EDs into beds if they need to be held overnight as quickly as possible. That's why we're working at the bed capacity. The pressures aren't just at the ED, it is our beds within the hospitals, freeing up beds in the wards so that people who come into ED and need to be admitted can be admitted as quickly as possible. We want that in every hospital. So we're working hard to implement new initiatives and to expand initiatives that we know do work to create that bed capacity, but we do need support, and that's why all of the health ministers are asking for the Commonwealth to step up and support us, because the pressure is only going to grow once COVID is right through this country.
So do you support mandatory vaccines for aged care visitors?
For visitors, well, there hasn't been a decision on that. Again, we will take the health advice. It is important. I know I cannot walk into one of our public aged care facilities unless I show my certificate saying I'm vaccinated for the flu. So we actually already require people to show that they've been vaccinated for the flu. So if the advice is that we should go down that path, certainly we'd consider that advice. But one thing I will say, because I found this quite extraordinary on Monday, that the Leader of the Opposition said that people don't like being told to get vaccinated. Now, that says to me that David Crisafulli is now stepping back again from mandatory vaccinations. He says people don't want to be told. Well, we've been asking politely for a long time. My question still is, does David Crisafulli support mandatory vaccinations in any form, including our health workers and aged care? Because his comments on Monday, or despite what he said in Parliament last week, his comments on Monday said people don't want to be told to get the vaccine. And he should explain what he means by that. Is he opposed to mandatory vaccinations? Thanks.
About restrictions, we've heard that once the borders open up, it will reach 80%, that vaccinated Queenslanders might be allowed into pubs and stuff while unvaccinated aren't. What other freedoms do vaccinated people have?
Look, I think that's still being worked through at the present stage and talking to a whole heap of industry sectors and relevant departments as well. But I think vaccinated Queenslanders will have extra freedoms, but with freedom comes responsibility. And really that means getting vaccinated, remembering if they have symptoms, get tested. I think it's as simple as that, really.
On international arrivals, just clarify that one, because I don't understand. If you're coming from an once all the borders open, you've got people coming in from red zones, being New South Wales and Victoria.
Yep.
Say someone's coming from the US or another country. What's the actual difference in risk?
I'm not quite sure what you're asking, but remember New South Wales...
What's the risk between a traveller coming, a double-vax traveller from New South Wales and say a double-vax traveller from the United States? What's the difference in risk?
There are two differences. One is a greater degree of uncertainty about people coming from international arrival ports and what their background, their vaccination status, even the quality of the test at times, depending on where they're coming from. Whereas I think we can probably trust the vaccination status and test status of someone coming from New South Wales. The other part, as I said before, is this is about staggering the arrival and the impact on our own health system and protecting our own community. If we can do that by letting Queenslanders and other Australians come back into Queensland first and then slowing down the rate of arrival of international arrivals, that's only a good thing, because it means that we can protect Queensland and protect our health resources.
What kind of proof will people have to provide that they've been vaccinated? Say, you said 17 when you've got the road and their borders are at the same time. How will that actually work?
Okay.
So what we're doing is we're updating our border pass system now, so people will be able to upload their vaccination status, and they'll be able to upload their negative test results. So that will be really important, because that will mean that the moment that border pass is issued, that's verification that they've met those two criteria. So it's really just about showing the border pass, not having to show the documents that sit behind that. But so what we're talking with the police how to operationalise this at the moment. Yep. So we're working through how to operationalise that. As I said the other day, it's going to be important that we still have a system where we can be confident that the cars all coming across the border are meeting that requirement and have the valid pass until we get to that 90% mark where you don't have to have a pass at all anymore, or certainly don't need to prove your vaccination and have a test. So we're just working through with the police what that looks like. I get there's going to be thousands and thousands of cars going back and forth across the border every single day once we hit that 80% mark. So we want to make sure that, the cars can flow. I'm very mindful, Christmas holidays and everything coming up, it will be even busier. So we're working through police how we do that, and whether it's checking every single vehicle, whether it's, random stops and checks, whether they're just, waving people through. We're just working through the operational side of that now.
And those in the hub, that live in that little hub, I guess, border hub, it probably might be a bit easier for them to
Absolutely, and I know a lot of those people, in fact, we talk about our percentages of how many people we've vaccinated. That's just the Queenslanders. We've actually vaccinated over 100,000 New South Wales residents as well, because they've all come to us to get vaccinated. So I suspect that a lot of people in those border towns have very high vaccination rates, some because they're essential workers, but others just want to stay safe because of the outbreaks that they have had. So yes, life will become a lot easier for a lot of people when we hit that 80% mark, but we have to remember that's when the virus will start moving through the state, and it might become a lot harder for small towns who don't have high vaccination rates and start seeing a lot of positive cases. Yeah. Yeah, so we're just working through, as I say, it's far easier to make sure those documents are uploaded to get your pass in the first place, because that way you're not having to stop and be checked. We'll sure do random checks of that, so that if, for example, at the airports, I mean, the airlines have been fantastic wanting to work with us about vaccination and checking status. It may very well be we do random checks just to say, well, you've got your border pass, please just show us your vaccination and your negative test results as well, just to double check that people are being... There's always been a fair bit of trust involved. The whole system has been based on trust and honesty of people coming in and telling us, have they been in a hotspot? Remembering, when we've had individual hotspots interstate, we've relied on people who are flying in from Sydney to say, I haven't been in a hotspot. And they've been able to move freely throughout the entire state. Now, we've found on some occasions people have not been honest in the past that they've filled out, and in fact they have been at a hotspot and they've come in with the virus. But we have been extremely fortunate that those numbers have been limited, and we have identified them quickly, and we have been able to isolate those people. But that's how we've had outbreaks, is where people have been providing false information or unlawfully crossing the borders without the proper pass. So we do require a lot of honesty and trust in what we're doing. Thanks, everyone.